So what kind of work did you do?
So I actually work in revenue cycle, and so from that perspective, I did revenue cycle operations, where we work with the local the hospital with those systems and improving their processes to improve basically their revenue output. So as a part of improving their processes, we brought on information systems to help understand what was happening with those financial accounts, what was happening from a process standpoint, and those like key performance indicators that we would be reviewing on a weekly basis to understand just kind of how much is expected, how much pending revenue, where the opportunity gaps were, just in terms of following up on those accounts and working with those accounts. More specifically, I work with around insurance. I work on what they call front end and back end of the revenue cycle. I work with self pay populations. I work with Medicare and Medicaid. So on the government side of billing and follow up. So I did all things revenue cycle within in a hospital setting. So I learned a lot about IT systems. So people, process, policies, and tools is really where I honed in on that concept. And so you asked a question earlier about change management. And so understand how currently the organization is operating, and then implementing or adopting a new system into that process, what it really looked like from a policy, especially when you're dealing with laws like HIPAA, as well as business rules, depending on the payer rules, and then working with the people within that organization to gain buy-in for the adoption of those software and systems and processes. Because at the end of the day, it's the people there that's going to be operating and using those tools. So I always think about sustainability of any change process really starts from the beginning, and how you start the process and how you manage the process through by bringing those folks along who's eventually going to have to manage those systems once that process or that project period is ending.
And then you moved into a senior business analyst role at Emory University.
Yeah.
And I believe you also got promoted in that role to the business unit director for the Informatics PHII, I think it is,
Yes.
which is one of your current roles, if I'm not mistaken.
Yes.
So, can you walk us through that process of getting into that senior business analyst role, and then what do you do, and then what did that progression look like?
Yeah. I had a phenomenal time in consulting. At the time, I was traveling 100% of the time, based out of Atlanta, but working domestically across the US at some phenomenal health systems with some very smart people. It was great to be around. But I came to a point in my career where I was questioning what was next. And so, I was looking into doing an MBA program at the time, but I'm a person of faith. And so, you know, being in prayer about what was next for me was so important. And doing something more in the global space was really, really important. So, what actually happened was I had an opportunity to do an international project as a part in consulting. We work with Habitat for Humanity International, and I went to El Salvador. And in El Salvador, we built homes, and we integrated with families. And I got to know this little boy named Charlie. And Charlie wanted to be a surgeon. Um, and basically everything about, a lot about where his community was in the resource setting, it just seemed like it would be a difficult thing for him to be able to become a surgeon just because of the circumstances. But I was so inspired by his passion and just his zest for life. So I knew at the time in doing that work with Habitat that I wanted to do something in the global space, and I wanted to be something very purpose driven. So that really shaped my path in terms of not going directly into an MBA program, which is more the natural path when you're in management consulting, but doing something different. So I was in Portland at the time and working out in Portland. And I ended up walking by this graduate fair, and Emory University School of Rollins was at this fair and graduate school affair. And I had this conversation around their public health program. And I got introduced, and Melissa Crancer, she's out there and she's listening to this. We had a lot of conversations, and over the period of a year, we stayed in touch. And, I eventually said, you know what, I actually want to pursue my MPH. And so from there, I think that's where everything kind of changed. So my second experience in the global space, and just kind of being curious and getting to know Emory and the School of Public Health. And they had just a program that I just thought was super perfect for me and my background, doing applied public health informatics, doing my master's focused in that. And so once I got accepted to the program, I knew that I wanted to, because I was on an executive program, I didn't want to become a full time student again. That was just not appealing to me. So I wanted to get both experience as well as what I would call the theoretical in terms of the coursework. So I came I got accepted to the program. And then from there, through the program and getting to know more about being at Emory and some of their affiliates, I found the Public Health Informatics Institute, the Task Force for Global Health. And so it's just kind of, I got into my MPH program, and then I transitioned into an actual position here at the task force. And, at the time, it was a step back in my career, just in terms of where I was in consulting. But it was a step back in terms of my career. But it was the right pivot for me. It was the perfect pivot for me. Being a senior business analyst, my background in working with health systems and processes and implementation of those systems was just a perfect fit for me to come over and be able to hit the ground running and I did well when I was in consulting, and then also be in a graduate program at the same time in terms of learning public health and learning the concepts around it. So basically, I like to call it learning the language of public health. At the time was just a perfect marriage.
Well, I appreciate you sharing that